Sympathetic ophthalmia. So in case of sympathetic ophthalmia, it is a bilateral granulomatous panuveitis, and this is seen after a penetrating trauma. And what is to be known is that in case of surgeries, it is less frequently seen and usually multiple, in case of multiple vitreoretinal procedures. So in case of trauma induced, it is seen between the, in case of trauma induced, it is seen between the 2 weeks to the 3 months time frame, and this is after the initial injury is about 60 to 70%. So the earliest symptom, if you see, is the blurred vision, and blurred vision, this is near blurred vision. And next, if you look at the earliest sign, it is the retrolental flare. This is in the sympathizing eye. Next, if you look at the anterior uveitis, this develops in both eyes. And the fundus, it shows a multifocal. The fundus, if you see, it shows the multifocal choroidal infiltrates, and they developed in the mid periphery, and this is along with the subretinal pigment epithelium, and the infiltrates, it corresponds to the Dallen fuse nodules. And this Dallen fuse nodules, they are, writing again, the Dallen fuse nodule. So they are nothing but a granuloma, and they are situated between the Bruch membrane and the RPE. Next, we are looking at the treatment. So in case of the treatment, there is something known as the steroids. So they are the basis of the treatment, and they have high dose oral prednisolone. This is given for the several months. Next, there is also the immune suppressives. So immune suppressive, it includes the azathioprine, cyclosporin, as well as the methotrexate. So they can be used in resistant cases or as a steroid sparing agents. Next, what is seen is the enucleation. So in case of enucleation, this is of severely injured eye, and this is with no potential within, no visual potential. This is within the 2 weeks of injury, and it prevents the occurrence of the sympathetic ophthalmia.